How do you fix spinal stenosis without surgery? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 5 exercises that you can use to fix the symptoms of spinal stenosis without having surgery. Now, first of all, what is spinal stenosis? Spinal stenosis basically means a narrowing of the spaces in your spine where the nerves run. And that can happen either in the neck or in the back, but in this video, I'm going to refer to spinal stenosis of your lower back. Now, there are 2 different types of spinal stenosis. You can have central canal stenosis, where your spinal cord runs down through the center of your spine. You can also have lateral stenosis or foraminal stenosis, where the nerve roots exit on either side of the spine. Now, in either of those cases, bending backwards like this narrows the spaces where the nerves come out on the side of the spine. It also kind of kinks the spinal cord in the canal. So usually bending backwards or standing straight up tall makes spinal stenosis symptoms worse. That's why a lot of times you see people who have spinal stenosis kind of walking hunched over, because that opens up the spaces in where the nerve roots come out, as well as the space in the center of the canal where the spinal cord runs. Now, that doesn't necessarily mean that you'll have to walk hunched over. There are a few tips that we can go through later in this video that will help you to walk a little bit more upright. But that's the reason why people tend to walk bent over if they have spinal stenosis. So what exercises can you use to relieve the symptoms of spinal stenosis? Well, those exercises, they largely fall into 2 different categories. One category is exercises to do when you're having an acute bout of symptoms, and the other ones are more longer-term things that don't necessarily relieve the pain right away, but they help to make the problem overall better so that you don't continue to have the symptoms over the long term. So first of all, what are the symptoms to do if you're having spinal stenosis symptoms? And usually that's pain in your back, but even more so pain that radiates down the leg, particularly when you're standing or when you're walking. Well, the immediate fix is that if you are standing or walking, like I said, if you're up tall like this, leaning forwards helps. Oftentimes bending forwards helps even more. So any type of forward bending stretch, whether you do that standing up forward bending or sitting down, bending forward like that, that opens up the spaces on the side of your spine, as well as makes the spinal canal functionally larger when you bend forward so that your spinal cord has more space. And that oftentimes will relieve symptoms very quickly when you have spinal stenosis. Now, every form of those relief exercises that I mentioned is some form of forward bending. Now, either forward bending in standing or sitting, that's one exercise that you can use. But if you're having a really, really bad bout of spinal stenosis, sometimes even doing that won't relieve it, because you're still upright, gravity's still pressing down on you, you still have to activate the muscles in your lower back. And so the best way to relieve spinal stenosis, if it's really, really, really bothering you, is to lay down and then just bring both knees up towards your chest like that. That way you're not bearing weight, gravity's not pushing down on you, and you're also bringing your spine into a relative flexion position like that, where you're doing forward bending, just your forward bending happens to be when you're laying down. Now, additionally, if you are able to kneel on your knees doing child's pose, or sometimes they call it a prayer stretch, where you rock back like that, that's another really good stretch to help open up the spaces in your lower back. And overall, that's one of my favorite exercises for back pain. But for people who have spinal stenosis, sometimes you might have trouble getting on or off the floor. You can do it on a bed or a couch like I just did. But some people have arthritis in their knees as well if they've gotten to the age where they're having spinal stenosis. And so that is a really good stretch, but if that doesn't apply to you, if you can't do that comfortably or it just doesn't work for you, doing either a seated forward bending stretch like I showed at the first, or doing a laying down stretch where you pull your knees up to your chest are good exercises to help if you're having symptoms of spinal stenosis at the moment. Now, the bad thing about those exercises is that they work very well at the moment, but they don't necessarily fix the long-term problem. And so they're good if you're just needing some symptomatic relief for the moment, but they don't necessarily fix spinal stenosis per se. So what can you do to get more of a lasting fix for spinal stenosis? Well, that has to do with decreasing how much trouble you're having with standing and walking. Because again, that's usually the most common symptom that people with spinal stenosis have, is that they have trouble standing and walking. So if you're standing, again, when you're standing with a lot of arch in your back, that makes symptoms worse. Now, one thing that people do with spinal stenosis is they lean forward like that. And not that there's something inherently good about leaning forward, but that flattens out the curve in your back. Now, if you have tight hip flexors, then they pull you forwards. And in order to stand upright, you have to arch your back like that, which narrows the spaces where your nerves come out. It kind of kinks the spinal cord and makes things not feel really good. So if you can stretch out your hip flexors by putting one leg in back, one leg in front, and then just kind of rolling your pelvis under. Again, you want to keep your spine fairly flat, so you may lean forward a little bit, but just go until you feel a little bit of a pull right there. Now, if you're having an immediate bout of spinal stenosis, that won't relieve it. And in fact, it might actually make it feel worse if you're in the heat of a flare-up. And so I wouldn't recommend doing that when you're hurting. But if you do it when you're not hurting, it can help prevent things from hurting as quickly when you are standing and walking. So again, the leg you're stretching goes in back, the other one's staggered in front, and then you just push your hips underneath of you a little bit, keeping your spine relatively flat, not arched like that. You don't want to stretch that way. You want to keep your spine relatively flat, push your pelvis forward, and just feel the stretch in the front of that leg. Now, the other thing that you can do to help flatten the curve in your back is just to practice when you are standing, instead of standing with a lot of back arch, to practice doing a little pelvic tilt exercise where you roll your hips back underneath like this and flatten the curve out in your back. And you can do that whether you're cooking in the kitchen or whether you're doing chores, whether you're standing in line at the grocery store. Whatever you happen to be doing, if you're standing still, then rolling your pelvis underneath and standing like that is a good stretch to help reduce the amount of curve you have in your back. And that'll help symptoms of spinal stenosis when you're standing still. Now, additionally, even though walking is one of the things that people with spinal stenosis have the most trouble doing, walking is a really, really great exercise for spinal stenosis up to the point that you start to have symptoms. And I made another video about walking problems with spinal stenosis, and I'll link to that video below here so that you can get more tips on how to walk more comfortably. Now, beyond that, if you are having spinal stenosis and you're looking to avoid surgery, I would recommend connecting with a physical therapist near you. If you happen to be in the St. Louis area, we'd love to help you out with that at More for Life. Just contact us at our office and we'll get you scheduled in for an appointment. And no matter where you're watching from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.